Hello and welcome back to this series on SYNLAB podcast. We've been discussing the topic active balls, maintaining prostate health. And I am Pasty Mokungah. I'm still your host. With me here today is still the prolific Dr. Habeebu Muhammad.
Thank you for having me.
Okay, so far so good. We've been understanding prostate health and we've learned what the prostate is and how important it is to men's health, right? And now we're going to be discussing nutrition and lifestyle for a healthy prostate. I'm very curious about this. And what's going on in my head right now is like sugar. You know, from when I was a small girl up till now, I'm still a small girl. Well, I've heard that sugar is very bad for men. So I'm wondering if it affects prostate health. But how does diet generally affect?
Well, diet generally, like every other organ, we need a balanced diet. We need minerals. And you can get these minerals from various fruits. Tomato is one of the fruits that has, enough minerals for prostate. So prostate, with good balanced diet and vitamins, you have a good prostate.
Well, so that would mean that like Nigerian men should have good prostate because we eat stew all the time.
Yeah, Nigerian men on average have good prostate.
Really?
Yes, on average.
Yeah, that's good. I think people will be very happy to hear this.
Yes.
Nigerian men have good prostate. I hope this does not mean you should not go to hospital. Okay. So, I was going to ask you what food should men include, but apart from tomato, what else?
Most of the fruits.
Most fruits
have a good enough, Nigerian men are very, they are very virile. You have you can assess with the number of children we have.
This.
So we have on average we have good prostate.
On average, you have good prostate. Okay. So are there any particular foods to be avoided or habits to be avoided?
Maybe excess alcohol and cigarettes. These are, what can affect the prostate, the fertility of the prostate, yes.
Okay, so the fertility of the prostate, like we established before, it tends to, should I say, for lack of a better word, worsen with age.
Exactly.
So will it be better, should you stop these things early than later? Or is it like as you're growing older, then you should give yourself sense and say like, I'll stop smoking? The
earlier, the better. It's better even not to smoke.
At all.
And the exercise is also one major factor that improves the prostate. If you are doing exercise, you are fit, then your prostate is also better.
Okay, you mentioned smoking. So is it just cigarettes? What would be the impact of other recreational smoking activities like weed, or what is popular today, shisha?
All of them are implicated.
All of them are risk factors.
Yes, because they all have the byproduct of smoke.
I have a feeling that people are going to feel like you're telling them not to chop life. You're telling them not to enjoy their life, because these are things that the youth today see as, when you go out with your friends. I mean, I don't believe that. But when you go out, a lot of people, what if they are not drinking alcohol and they are not smoking shisha and they are not smoking weed? What should they now do?
Well, like I said, in moderation. Anything they want to do. Okay,
so they can do, but in moderation.
Yes, they have to do in moderation. But if you can keep off it, it's still better.
I hope people are hearing. Try your best to keep off it. And you have mentioned that regular physical activity. So you're encouraging like more exercise. Are there particular exercises that help, or just generally?
General exercise, like, walking some distance and sweating it out. Like twice a week. Just being fit. Any exercise that will make you fit will improve your prostate too.
Okay. So besides exercise, besides food, what other lifestyle factors? Maybe sleep. How does stress affect your prostate?
Stress is one factor that reduces the health of the prostate. You need to get off stress. You need to sleep well, just like you rightly said. Sleeping, at least between 6 to 8 hours a day will also help to improve.
6 to 8 hours in Lagos, Nigeria, for instance.
Well, 6 hours is just from 12 to 6 in the morning.
Well, from 12 to 6.
12 p.m. And most people will sleep before 12.
I don't know. They tell young people these days, like if you are sleeping. Have you seen when what they call all these speakers? No, motivational speakers are telling you to put your life, like, what are you doing? Why are you sleeping? And you're telling people to get 6 to 8 hours of sleep.
Sleep has its own function. Well, we are designed to also sleep. There are a lot of processes that go on when you sleep. In fact, stress. If you don't sleep the normal hours you're supposed to sleep, you have stress. this will build up, and it will not only affect your prostate, it will affect your mental health.
I was just about to ask, is it just physical health or mental health?
Both
mental
physical
health
and
could
mental
also
health.
affect your prostate.
Yes, if your mind is not in order, you won't be in the mood to do anything, and it will affect your prostate.
Okay, and this can all be contributing factors towards like cancer?
Well, for cancer, the most important factor is age.
Oh.
Yes, as you grow older, your predisposition also increase towards having cancer. It is said that if you don't have cancer, you are not old enough. That's why. Because as a man...
I have never heard that.
Yes.
Wait, that's just for prostate cancer.
For prostate cancer. I'm talking about prostate cancer. Yeah, both prostate cancer and BPH.
Okay.
As you increase in age, you are likely to... Your chances increases. So that's why you need to step up screening as you get beyond certain age.
Oh, okay. I was about to ask, so around what age should you start worrying?
40.
Okay, from
40. But if you have a strong family history, for example, grandfather, father, or brother, or two or more of your relative has prostate cancer, then before 40, like 30, you should start screening.
Okay, so what I'm guessing from this is that prostate cancer is also kind of hereditary?
It can be hereditary. There is a gene called BRCA2 gene,
okay,
which can, predispose people to prostate cancer. It can also predispose to breast cancer.
The same gene?
The same gene.
Oh,
yes.
So
this gene, apart from age, are the factors that has been implicated in prostate cancer.
So we need to watch out for your family members to know.
Yes.
I don't know how possible that is, because we have a history of men in maybe this part of the world, Africa, that have not really taken their medical health seriously. So there might be a lot of men who don't even know that they have a family history that predisposes them to this.
Yes, they are. Well, but in the nuclear family, it's more important to know the health of the men in that nuclear family, like the father, the brother, maybe the uncle, which is a bit of extended.
Okay, so we'll be able more nuclear than extended.
Yeah, more of nuclear family than extended, yes.
Okay, this is very educative so far about prostate. But now, when it comes to the hereditary transferability of prostate cancer, does this also roll over to other prostate issues like the BPH?
No study has linked that gene to BPH. BPH is strictly age linked. So the older you are, the more the chances of having BPH.
That's okay. So you don't have to bother about your family there.
Yeah.
Okay. This has been really educative. So what we've learned so far is that when it comes to prostate cancer, or rather when it comes to prostate health, generally, your nutrition matters. Your
nutrition, your behavior. Are you a cigarette smoker? Are you an alcohol? Your physical activity. Do you do exercise? Your stress level. Do you sleep well? Are you undergoing excessive stress? All these factors.
So physical factors, mental factors, even social factors come together to contribute to your prostate health.
Exactly.
And everybody needs to watch out for this. And like you said, the earlier the better. Whenever, as soon as you can start taking your prostate health seriously, you should take your prostate health seriously.
Yes, and it's also very important to prevent activities that will lead to recurrent prostatitis. That's
what
infection.
Kind of activities?
Where indiscriminate, unprotected sex can also increase your, your chance of having recurrent infections. So that's also part of it.
Are there physical activities like playing sports? Are there things that will predispose you in that area?
No.
Okay.
It's only sexual activity.
No sexual activities. So you have to maintain a good sexual health. What if somebody wants to keep multiple partners and say they get tested often?
No, except you use barrier. Because you can't tell all your multiple partners to be tested each time you want to see them. You can test somebody a week, and then today the person is already infected and you wouldn't know.
That's true. So there's a lot of proactivity to be had here.
Yes.
That's very interesting, and I think it just all points to the fact that people should be more serious. Men should be more serious with their prostate health. They should take it
more responsible about it.
Because I feel like it maybe a lot of men hear prostate and they just think it's not that serious, but apparently it is that serious, and all aspects of your life come together to contribute to just having a healthy prostate as you grow older.
Yes, and it's not only seen in elderly men, it can be seen in younger men. We are seeing more in younger men. And in this part of the world, we actually see all this condition at earlier age than what it is in the developed world, like 10 years earlier.
So about, instead of 40, we're talking 30.
We are talking of 40. Most of the time, in the developed world, you see in 60, 70,
but here
we
we're
can see
seeing
from
in 40,
50, yes.
Which is pretty young.
It's pretty young, exactly. And once it comes, it obstructs it becomes a real body because it disrupts your activity.
Okay. I know that our audience has gained a lot from this, and I know that this would definitely influence a lot of people to start taking their prostate health more seriously. And this is more reason why, if you are watching this, you need to like this podcast, you need to share this podcast, you need to comment, share it to everybody, your brothers, your friends, your brothers' friends, your fathers, your grandfather, share it to everybody, and subscribe, because this doesn't end here. Sit tight, come back again. We're going to be here with more information about maintaining prostate health. I'll see you in our next episode.